Yes, guys, tell me. Reconfirm me actually. Please reconfirm me. Am I audible to all of you?
Yes, sir.
Okay. So yes, we completed last class. We have completed. Let me open the notebook. And last class we have completed our excretory system. So now, as per the schedule, we are supposed to start with the. Yes, this was the last thing which we did in last class. So excretion, we did all the things, maturation and all that, and finally we even did the dialysis part, right? And after the next part, what we were supposed to add on, that was excretory system, right? So we were supposed to do with the excretory system. Sorry, we were supposed to do with the locomotion and movement. Yes. So locomotion and actually the name of the chapter is locomotion and movement, and technically what we have to do, that is the this one, what to say, skeleton system, human skeleton system. In the skeleton system we are going to study two things. First important thing, that is the bone system, or complete bone, because these are the part which make our skeleton. But only the bones are not the skeletal part of our body. Our skeletal muscles are also responsible for the movement and locomotion. That's why they are also the part of skeleton. They give the shape to the body. They makes the structure form, right? So there are two things. Okay. Locomotion. Just a minute. Locomotion. In locomotion and movement, first we'll start with the human skeleton, right? Then first we'll do the human skeleton part, and means human bones part and bones, joints, and all that. And the later part, in the second half, we will do the sliding filament theory and the structure of our skeletal muscles, right? So that's how we are going to do. And you will get number of the question in your medical examination from this skeleton system, right? They will ask you, for sake of example, which type of the question they are asking. They'll ask you which of the following is not face bone. They'll ask you which of the following is the bone of skull. And even they have asked that how many bones are found in the skull part, right? How many bones are there in the skull, right? And even which of the following makes the pelvic girdle, and right, and other things like what is the synovial joint? Which of the following is synovial joint? They'll ask this kind of the question. Even which of the following is example of hinge joint and all that, right? So they will ask you question from the bones. They will ask you question from the joints. Even they have asked the question from the vertebral column. We'll study one by one, and then we'll discuss. So let's just start with the human skeletal system. Human skeleton. So human skeleton system. We are going to start with human skeletal system, right? So first I'll show you the human skeleton, and I will give you a brief about that. Look, this is the human skeleton, right? So we have divided. We'll study one by one. It seems to be a bit difficult for you actually, but this is not that much difficult. Only the thing which you need to understand, right? So the first diagram, it is from the front part, that is we called anterior part, and the second diagram that belongs to the posterior part, right? Okay. So here we are going to familiar with the normal terms and normal things which has been incorporated in our this chapter. So come to here. Look, this is our skull. Skull means this upper part, right? This is called skull. And below this skull, this shoulder part, what we call shoulder, that is made up of a front bone. So generally, we are able to see this front bone that is called clavicle, right? Clavicle. And then at the mid of our this rib cage, there is a bone that is called sternum. This is called sternum, right? Then these are the bones of the hand, humerus, and these are the ribs. And this back part is made up of vertebral column. We all know this radius and ulna is lower part, and this wrist part is called carpel. And then after the wrist, that this part is made up of the bones. They are called metacarpals, right? And then we have the finger-like fingers. We have the finger. These are called phalanges. And then the pelvic girdle, that is the hip bone, that is called pelvic girdle. And this pelvic girdle, this is actually not made up of one bone. This is made up of three bones: ilium, ischium, and pubis. Right? The question have been asked from here, right? And the lower bone, that is the longest bone of our body, that is called femur. And there is a bone in the like kneecap, that is called patella. This question even have been asked, which of the following is kneecap? Then tibia and fibula. Then again, the lower part our feet is made up of tarsal, phalanges, metatarsal, and phalanges. So the structure of hand and structure of the uh, this one, structure of the hand and structure of the legs, these both are almost similar, and terms are even almost similar. Will face that, right? And look, in the back side of our shoulder, back side of the shoulder, you see this kind of a structure. Like you can see clearly this kind of the structure in those who are the very thin and very skinny kind of the uh, uh, boys. So you can see them, right? This is called scapula, right? This is found a triangular structure behind your shoulder and the both of the part. This is called actually scapula. And again, hip is made up of three bones: ilium, ischium, and pubis. So this is called pelvic girdle. This upper part is called pelvic girdle, right? So what is the function of human skeleton, right? What is the function of, right? So look, again, one more important thing: skeleton system is of two types: exoskeleton and endoskeleton, right? So skeleton system, human skeleton. So when we talk about the skeleton system, it is made up of two parts, that is exoskeleton. Exoskeleton, these parts are clearly visible because they are found out of our body. For sake of example, hair, nails, etc., right? And when we talk about the endoskeleton, endoskeleton cannot be seen. Endoskeleton, it is not visible. These are basically bone. It is made up of bone and the second skeletal muscle, right? Skeletal muscle. So we are going to study these endoskeleton part, not exoskeleton part, right? Again, what are the function of a skeleton system? What exactly it do, right? So please start noting. The skeleton, which is external to body, the skeleton, which is external to body, like nails, hair, etc. The skeleton, which is external to our body, like nails, hairs, etc., are called exoskeleton. Are called exoskeleton. Full stop. Next point. The endoskeleton consists of those hard part. The endoskeleton is consist of those hard parts which are present inside our body. Those hard part which are present inside our body. Full stop. The function of skeleton system. So what are the function of a skeleton system? So when we talk about the function, so out of them, the first function is that support. They give support to, they give support to softer body part. They give support to softer body part. Full stop. Protection. Protection. They protect, they protect, they protect delicate body part. They protect delicate body part. Third, muscle attachment. Muscle attachment. They provide, they provide attachment for large muscles. They provide attachment for large muscles. Fourth part, fourth part. Movement. Due to contraction and relaxation, due to contraction and relaxation of the muscles, due to contraction and relaxation of muscles, the bones and body part, bones and body part changes their position, changes their position and bring about, changes their position and bring about movement, and bring about movement. Now the fifth part. Body shape or body form.
So,
Yes,
what was the first line? They give support to?
they give support to softer body part. That was the first point.
Okay.
Right. Fifth point is over. Now this sixth point. Blood formation. Sixth point, blood formation. Blood formation. Right. The RBC and WBC, RBC, WBC and platelets. RBC, WBC and platelets are produced in RBC, WBC and platelets are produced in bone marrow. Next point. They help in breathing and hearing. They help in breathing. We have already understood. They help in breathing and hearing. Both of the points we have already discussed in detail. They help in breathing and hearing. Next point. Mineral reservation. Mineral reservation. The bones maintain the calcium and phosphorus level of blood. The bones maintain calcium and phosphorus level of blood. Full stop. In case of great demand, excessive calcium and phosphorus. In case of great demand, excessive calcium and phosphorus. In case of great demand, excessive calcium and phosphorus is taken out from the bones. This was all about the function of skeletal system. Keep the function in your mind because this is important for your school examination, not for your medical examination. This was exclusively for your school exam, right? So I think it must be clear to all of you, right?
So,
Yes, please.
we did not write anything about the fifth point.
Sorry, Isra?
We did not write anything about the fifth point.
Fifth point.
Yes, sir.
Fifth point, please note it down. Body form. It forms or give body shape and form. It form and give body shape and body form. It gives, in fact, shape to our body, right? Clear? Uh,
Yes, sir.
now the first human skeletal system is that is the human skull part, right? Skull, try to understand it carefully. Why I'm saying try to understand it carefully? How you have to memorize these all the bones, because this is not the actually the thing to understand. This you have to cram. But if you cram while understanding, that will be easier, and it will be you will be able to retain it for longer time. For sake of example, look, there is a name of zygonemetic vein. Now, zygonemetic vein, right? Bone, right? So zygonemetic is a term, right? And we have to understand what does mean by zygonemetic bone, right? So zygonemetic means cheek, this cheek part, right? So if you learn that zygonemetic means cheek, then you will be able to understand these are the cheekbones, right? So that's how you have to learn. Like, look, parietal means rooftop, frontal means front, right? So we have to understand what does the mean of these terms. When you will understand what is the mean of these terms, then you will be able to recall it easily, right? During your examination time, basically during your medical exam, right? So that's how I'm trying to tell you, and you have to understand. Then you have to cram the name of those bones, right? Number of the time they will ask you how many bones are found in our face, how many bones are found in our skull and cranium part and all that. So just please try to understand. So put the first heading, the skull. So first skeletal system part is skull. Right. Look, this is the human skull. Now I'll tell you one by one what is the so a human skull is further divided into further category. So first we study the bone of human. It has been divided into many parts. So first we study the bones of cranium. So cranium is this part. This is called brain box actually, right? So I'll tell you one by one. So first is bones of cranium. Bones of cranium, right? Bones of cranium. I would like to a bit enlarge this diagram. Right? Bones of fine. Look. So bones of what are the bones of cranium? How many bones are found? So cranium have total actually 8 bones, right? 8 bones they make the cranium. What is the cranium? Cranium is the brain box. You can say brain box, right? So our brain is brain box. Actually, our brain is put inside box-like structure. These bones which make our covering of the brain, that is called brain box, right? So brain remains situated inside this cavity. So this completely called cranium cavity, right? How many bones? So total there are 8 bones in our cranium. Which bones are those which make cranium part, right? So first part is that the first bone is that is the frontal. So there is one frontal bone, right? So there is one frontal. Frontal terms, frontal means the front bone, right? That bone which is found in front. So that is called frontal bone, right? So one frontal, so there is one number. Then there are two parietal bones, right? So two parietal bones. So parietal means what does mean by the parietal? So parietal means that is the what is mean by parietal? Parietal means the roof and side. Parietal means roof and side, right? What it makes roof part and side part. This is so these are one parietal and another parietal. So these are two parietal bones, one frontal bone, two parietal bones, right? Next, there are two temporal bone, right? Temple means this temple. We know that this is temple where we just sometimes we get slapped, right? So temple, right? So there are two temporal bones, two in number. Temporal means temple. We know this is the temple, right? Two temporal bone. Then one occipital. Occipital. So what does mean by the occipital? Occipital means back of the skull. There is one occipital. Yes, there is one occipital. Occipital means back. Occipital means back of a skull. Back of the skull, right? So one occipital bone and one sphenoid bone. This one sphenoid, right? So sphenoid is wedge-shaped bone, right? Wedge-shaped bone, right? So this is one sphenoid. Sphenoid means wedge shape. Wedge shape. Wedge means axe shape, right? So this is wedge shaped bone. So there is one sphenoid bone. One sphenoid bone, right? And one ethmoid bone. Ethmoid bone. This is also one ethmoid. So what does mean by the ethmoid? So ethmoid also has this is the sieve-like. SIEVE, sieve-like. Ethmoid means sieve-like, right? So these are the bones of cranium. So look, how many bones? Let's count. 1, 2, 3, 4, 5, 6, 7, and 8. So there are total 8 bones which make the bone of cranium, or they make the cranium. So please note it down. The cranium is formed by 8 bones. The cranium is formed by 8 bones. One frontal, comma, two parietal, one frontal, comma, two parietal, comma, two temporal, comma, one occipital, comma, one sphenoid, and one ethmoid, one sphenoid and one ethmoid bone. Full stop. The cranial cavity is the space where our brain is lodged. Cranial cavity is the space where our brain is lodged, right? So the second part is that the bones of ear. So we know that the ear bones they are not visible ear bones because they are found internal part, and we have already understood that ear bones, what we call ear bone, we have already understood what we call ear bone. We call them ear ossicle. Do you remember or not? We call them ear ossicles, right? We call them ear ossicles, and we have already understood and we have studied in detail. The ear bones are two malus. Note it down. Two malus, two incus, and two stipes. Two incus and two stipes, right? So we know that there are total 8 ear ossicles or 8 ear bones. So cranium bone are 8 in number, ear bones are 8 in number, right? So look, now, so these are the ear bones. Then it comes to a separate bone, and that bone is called hyoid bone. Hyoid bone, sometimes it is not considered as this one. This is hyoid bone. Why when I was teaching you respiratory system, on that time I pointed out that hyoid bone, some of the scientists consider this is the part of the skeletal system, and some of the scientists consider that this is the part of respiratory system. So this is a still conflicting issue. Most of the scientists think that this is the part of the skeletal system. So hyoid, please note it down. Hyoid bone. The hyoid bone is situated the upper part of throat. Hyoid bone is situated the upper part of throat just above larynx. Hyoid bone is situated the upper part of throat just above larynx. Full stop. Although it is not bone of skull proper. Although it is not bone proper of skull, but it is considered the part of yes, say it. Although it is not the bone of skull proper, but it is considered the part of skeletal system. Now the fourth part is bone of faces, right? Facial bone, right? Bone of face. And put the heading, fourth heading, that is the bone of face. Bone of face. I'll demarcate all these bones with the name with red color, right? So there are 14 bones. 14 bones. These are facial bones. Many times they have asked you which of the following is cranium bone, which of the following facial bone, right? So there are total 14 bones. So first, like there are two zygomatic bones. Two zygomatic bones. So there are two number, two in number. And what does mean by zygomatic? So zygomatic means cheekbones. We have discussed. Zygomatic means cheekbones. They can ask you which of the following are cheekbones. Zygomatic are cheekbones. So there are two in number. Again, there are zygomatic. Then there are two maxilla and two nasal bones. So two maxilla. So maxilla. What does mean by maxilla? Means upper jaw. There are two maxilla. Maxilla means upper jaw. Two maxilla, and then mandible. So there is one more bone that is called mandible bone. Two maxilla and two. Okay, some of the bones are not visible actually. The bones which are found inside our eyes and inside our nose. So these bones are not visible, right? So two maxilla, two zygomatic bones, and two nasal bones. Yes, there are. Yeah. Nasal means nose bone. Nose. So there are two nasal bones and two lacrimal bones. Nasal bone. Yes, lacrimal. Two lacrimal bones. Lacrimal bones. The name of lacrimal is actually for tear, right? So actually, in here the tear glands are found, and tear glands are called lacrimal gland, right? So these lacrimal bones are found below the lacrimal gland. That's why we call them lacrimal bone. So two lacrimal, two nasal, two zygomatic, two maxilla bones, right? Lacrimal means tear, and nasal means nose, and zygomatic means cheek, and maxilla means upper jaw, right? And then two lacrimal, one vomer, and two palatine bones. These are not visible. One vomer, one vomer. These are found inside our this system, this nasal system. One vomer and 2 palatine. Palatine. Palatine bone means palate. Right? Inside these part, 2 palate bones and 2 inferior nasal conchae, 2 inferior nasal conchae. Actually, these nasal conchae bones, these are found inside our nose part, right? From where the air goes from our nose and where it collide. So they are found internal part of our body, right? Right, above side to the palate, right? So these are called 2 nasal conchae bone and 1 mandible. This bone, 1 mandible is this bone, right? So these are the bones of uh, mandible means chin part, right? So these are the bones of our face, right? So there are 2, 4, 6, 8, 9, 10, 11, 12, 13, 14. So total bones are 14. Clear?
Sir, what is meant by mandible? Like
Mandible
maxilla
means
is the
chin
upper
part.
jaw.
Chin.
Sorry?
Maxilla means upper jaw and mandible means lower jaw or chin part. So mandible. Lower jaw, you can say lower jaw or chin. Lower, no, lower jaw. Like inside our nasal part. Actually, this is not visible to us over. So that's why it cannot be shown in the diagram. I think the meaning of vomer is not there. Vomer. Yes. The meaning of vomer is not given. Okay. So there are total 14. Clear? Note it down.
Yes, sir.
Any doubt? No?
No, sir.
In the last, please note it down. Thus, the skull is consist of 29 bones. Thus, the skull is consist of 29 bones. Skull is consist of 29 bones. Full stop. Look. Now put this next heading, vertebral column. So a number of the time they will ask, at least you have not to like nobody is going to say you that please write down all the bones of face or all the bones of cranium. But yes, which kind of the question have been asked in previous year question bank. If you'll go, they have asked that which of the following is not facial bone, which of the following is facial bone, which of the how many bones are found in the face, and how many the question they have asked it that the number of facial bones they have been asked, and which of the following is not facial bone. This kind of the question have been asked. Even they will ask you how many bones are there in cranium, and which of the following are the cranium bones. So this kind of the question they have asked, right? So at least if you will go through it 2 or 3 times, so you'll be able to understand, right?
Sir,
Yes.
what are the ear bones? Can you please repeat it?
Ear bones, yes, they are the total 8. We call them ear ossicles. Yes, we have studied in a neural system, right? So 2 malus, 2 incus, 2 malus, 2 incus, and 2 stapes. 2 malus, 2 incus, and 2 stapes. Clear?
Yes, sir.
Okay. Now the next topic will be vertebral column. So put the heading vertebral. Next heading is vertebral. Simple. again here you need to understand. Look, these are the actually bones of vertebrate column, right? Please try to understand. This left side as a side view, and this is from the back view, right? So try to understand. So actually, initially we have 33. Look, before going into that every part of the vertebral column, every socket of the vertebral column, every bone of the vertebral column, that is called vertebrae, right? Vertebrae. So vertebrae is a unit of backbone. Unit of backbone. Because backbone is made up of total, there are 33 vertebrae. So total there are 33 vertebrae, right? Out of these 33, when we born, we take birth with the 33 vertebrae. When we become older, what happened? There are certain bones which fuses. So 5 bone fuses and they make the sacrum. So sacrum is, that is the fusion of 5 bone. Fusion of 5 bone. So 5 bone become 1 bone. So then you can reduce, you can minus what? You can minus 4 bones, right? So minus 4 will be over there, right? Then what happened? This coccygeal, this coccyx. So coccyx is the fusion of 4 bones, right? This is the fusion of 4 bones. So what happened? These 4 bone fuses and become 1. So what will do? Will reduce minus 3. So how many bones and the adult person? So 33 minus 7. So 33 minus 7, and that will be total number of how many numbers there? 26. So there are total 26 bones or vertebrae in adult. Is it clear?
Yes, sir.
That thing you need to remember, right? Look, again on the basis of curve, try to understand. The curvature of the backbone is a point of evolution. This is the sign of evolution. When our backbone become curved, then we could be able to stand straight. A monkey become a erect, like got an erect posture and become a human during the course of evolution because of this curvature. So we get the curvature. That is the point of evolution. That is a part of evolution. So we have divided these in 4 categories, right? So cervical, thoracic, lumbar, sacrum, and coccygeal. So cervix means neck part, right? So there are 7 cervical bones, right? Means around the neck. So these make actually neck. So these are 7 cervical. Then thorax means respiratory part. So there are total 12 thoracic bones. So 12 bones are found around our lungs. So there are total 12 thoracic bones. Thorax means that is the respiratory part. Respiratory part, right? Then there are 5 lumbar bones, right? 5 lumbar bones. Lumbar means near the stomach part, digestive system, lumbar bone. Then there is 1 sacrum and 1 coccygeal. So these are the fusion of 5 bone and 4 bone respectively. So that's how our vertebral column is made up of. Clear?
Yes, sir.
So please note it down. First, please note it down all these points. Then I'll tell you some more points. Done. Start noting now. Vertebral column is 71 centimeter long. Vertebral column is 71 centimeter long. Full stop. It is curved and made up of. It is curved and made up of 33 vertebrae. It is curved and made up of 33 vertebrae. Full stop. Next point.
So the 71 centimeter is in adults, right?
Yeah, straight. That is straight length. So, however, it consists of 26 bone. However, it consists of 26 bones because 5 sacral vertebrae because 5 sacral vertebrae fuse to form 5 sacral vertebrae fuse to form one sacrum. 5 sacral vertebrae fuse to form one sacrum. And 4 coccygeal vertebrae fuse to form one coccyx. Fuse to form one coccyx. Right? So this was vertebral column. Is it clear? Clear to all? Next, come to the next heading, and the next heading is that one more thing. I want to tell you, there is a vertebral formula. So, what is the vertebral formula? That is important for you. Vertebral. Put the heading vertebral formula. So, vertebral form. That is C7 means 7 cervical. T12 means thoracic 12. L5 means lumbar 5. S then L5 is S sacrum. So sacrum, in sacrum there will be one bone. So S in bracket, that is the 5 fuse bones. This bracket represents the fuse bone, right? And S and C4 in bracket, right? This is called actually vertebral formula. And put one more point.
So why is S5?
S5 means sacral is made up of, that is a fusion of 5 bones. This one. And we have put bracket. Bracket represent the fusion.
Yes, sir. Okay.
The bracket represent the fuse. Like, in human that plant morphology, we have studied Gamosepalus. Yes? Gamosepalus, Polycephalus,
Yes.
Polypetalus, Gamosepalus. So we say actinomorphic, bisexual, calyx 2 plus 2, corolla 4 cruciform, right? Gamopetalus, like that. So next heading is sternum or breastbone, right? Sternum and breastbone. And bone of ribs. Sternum and bone of vertebral. This was second in number. Then the third one is that is the sternum. Sternum. Then the second is that the rib cage. Sternum.
Sir, is this vertebral formula important for our exams?
Yes, it's important for your exam. You have to
Okay.
remember that. Sternum. Right, rib cage. First sternum. Right. This is this dagger shaped bone. This is called actually sternum bone. Look. Look. This is actually called sternum. This dagger shaped like structure. This is found at the central at the mid part of our chest. Right. This is called sternum. So sternum bone is a dagger shaped bone. Look, this upper part is called clavicular notch. Actually, clavicle. This front shoulder bone, right? Clavicle. It fits in center part, right? It fit into center part, and that part where it is put over there. So that is called clavicular notch. So clavicle get fits in this bone. That is called clavicular notch. Then this head part or front part is called manubrium, right? And then this part is called body, and the last pointed part is called xiphoid process, right? You have to take care of only those part where I'm putting the red color underline. I'm underlining, right? So first clavicular notch, then this part is actually called jugular notch. This is called clavicular notch. Then this is manubrium, this is body, and this is xiphoid process. And these are the girdle where the coastal cartilages, right, are bones get fit, right, are these ribs get fit over here, right? We are not going to discuss anymore over here, right? So please note it down. The sternum or breastbone, it is about 15 centimeter long. Let's stop. It is about 15 centimeter long. Its shape is like its shape is like dagger. Its shape is like dagger and consist of three part. Consist of three part: manubrium, body, and xiphoid process. Consist of three part: manubrium, body, and xiphoid process. Full stop. The function of the sternum.
1 minute, sir.
Sorry. It is shaped like dagger, consists of three part: manubrium, comma, body, and xiphoid process. Full stop. Sternum help in sternum help in respiratory process. Sternum help in respiratory process, right? That is the function of sternum. Next, rib cage, right? this is actually rib cage, right? So look, it is very important. First, let me try to make you understand. Look, ribs are made up of bones, but they do not directly connect with the sternum, right? They connect with the sternum with the help of a flexible structure that is actually made up of cartilage. We have already understood what are the cartilage. We have studied in detail in tissue system, right? So actually, the sternum is these ribs are connected. These ribs are connected to the this sternum with the help of a cartilage, and the name of that cartilage is called costal cartilage. So costal cartilage, that's why whenever we press it, this is the flexible part. Otherwise, it might have been broken. When we press it, it might have broken, but it is not, it is flexible. So these costal cartilages, it make the rib cage flexible, and that's why whenever we respire, that this part comes upper and comes down, and it is a flexible part. It's a bit flexible part. So these ribs do not directly joint with the sternum. Actually, they joint through with a cartilaginous part that is called costal cartilage. First, okay. So look, there are total 12 pair of ribs, but only 1 to 7 ribs are called true ribs. Why? Because they directly connect with the what? Sternum. So look, from 1 to 7, they directly connect with the sternum. Then again, from the 8 to 10, 8 to 10, they are called false ribs, right? From 8 to 10, they are called false ribs, right? These are false ribs. Why? Because these ribs do not directly connect with, rather than 8 to 10, then we can say 8 to 12, they all are the false ribs. In fact, they all are the false ribs. Why? Because these do not directly connect with the mm, uh, this one sternum. They indirectly connect with the sternum. Look, this bone number, this is the 8th, 9th, and 10th. These bones indirectly connect with the sternum. They connect to the 7th ribs. So they indirectly connect. That's why we call them false ribs. And again, the 11th and 12th ribs do not connect with the any of the to sternum directly or indirectly. These keep on floating. That's why we call them floating ribs. Actually, these ribs are responsible for protecting the kidney. That's why they keep on floating, and these are called floating ribs, right? So look, this is the 12th rib, and 12th rib is connected with the 12th thoracic vertebra. So this is the 12th thoracic vertebra. And look, from the back side, they connect with the backbone, nor they fuse with the cartilage. They just remain kept like this one. This is a notch, and this bones is kept over here. Neither they are connected to or fused with backbone, nor they are connected with any cartilaginous part, right? They are just kept. From front side, they remains connected with the costal cartilage, and from back part, they are just put over here, right? That is the R rib cage. Is it clear or not?
Yes, sir.
So please just start noting now. There are 12 pair of ribs. There are 12 pair of ribs which form thoracic cage. Which form thoracic cage. Full stop. Next point.
Sir, can you please repeat the first line?
Sure. There are 12 pair of ribs which form 12 pair of ribs which form thoracic which form thoracic cage. Which form thoracic cage. Full stop. The first seven pair are called true ribs because the first 7 pair are called true ribs because their anterior end attaches to their anterior end, attaches to sternum directly, by means of by means of small pieces by means of small pieces of small pieces of hyaline cartilage, small pieces of hyaline cartilage, which is called as costal cartilage, which is called as costal cartilage. Next point. 8th, 9th, and 10th pair of ribs, 8th, 9th, and 10th pair of ribs are called false ribs. 8th, 9th, and 10th pair of ribs are called false ribs. Full stop.
So 11th and 12th are not false ribs?
No, they are actually floating ribs. But they are false ribs as well as floating ribs because they do not directly join. They are not actually real ribs. So they lie in the both of the categories. So 8th, 9th, and 10th are called false ribs. Full stop. They articulate by cartilage. They articulate by cartilage with costal cartilage of seventh ribs. Costal cartilage of seventh ribs and they are attached indirectly to sternum and they are attached indirectly to sternum. Full stop. The last two pair of ribs are called floating ribs. The last two pair of ribs are called floating ribs because their anterior ends are not attached to either sternum or cartilage of another ribs. Full stop. Next point need to underline.
So can you please repeat from anterior ends to what?
Floating ribs because their anterior ends are not attached to either the sternum or cartilage of another rib. Full stop. Floating ribs protect the kidneys. Next, function. The function of ribs is that they protect. The function of ribs is that they protect soft organ like heart and lungs. They protect soft organ like heart and lungs. Full stop. They provide surface of attachment for muscles, and they help in respiratory mechanism. Respiratory mechanism. Clear? Bones of ribs are clear? Clear to all of you?
Yes, sir.
Fine. So next heading will be pectoral girdle. Means that is a shoulder shoulder girdle, shoulder part. So next heading is, that is the fourth part. Fourth bone is in pec. Look. Pectoral girdle, right? So you can say shoulder. Pectoral girdle means shoulder. Look. As I have repeated many times, that clavicle is the shoulder bones is called clavicle, which looks in from in front. So this is actually clavicle. So clavicle fit with our posterior part. This posterior part is actually called scapula, right? Scapula. And starting of the class, we have studied that this the triangular bone which is found backside of the body. This is called scapula, right? And clavicle. Scapula and clavicle. This clavicle fits into scapula with the help of a acronium process, right? The acronium process. So acronium process is small bone that makes the clavicle to fit into. This is the actually the part of clavicle only, right? And it makes to fit into scapula. And collectively, they makes the both of the them are responsible for making our shoulder part, or we can say pectoral girdle, right? And in the pectoral girdle, in this scapula, there is a depression like structure in a scapula. So this complete part is called scapula. In a scapula, there is a girdle like structure or a hole like structure that is called glenoid cavity. In glenoid cavity, the head of humerus, this are bone of the hand, this head of humerus, it articulate or rotate over freely over here, right? So glenoid cavity is basically that cavity part which is made up by scapula itself, right? So clavicle and scapula, they are responsible for the formation of the shoulder part, and in the scapula itself, there is a glenoid cavity where the our hand articulate or rotate. Is it clear?
Yes, sir.
So please note it down. Each pectoral girdle, is consist of two bones. Each pectoral girdle is consist of two bones. First clavicle, and second scapula. Clavicle and scapula. Full stop. The scapula is also called shoulder blade. The scapula is also called shoulder blade. The scapula is also called shoulder blade. And it is triangular in shape. It is triangular in shape. right? Next point. Uh, the clavicle, the clavicle gets fit. Clavicle gets fit into the scapula with the help of clavicle get fit into scapula with the help of acronium, with the help of acronium process, with the help of acronium process. Full stop.
Sir, the spelling of this thing is MION.
Which one? I'm not getting you. What you are asking, Yusra?
Sir, the acronym process.
Acronym ACRO, ACROMION.
Okay, sir.
ACROMION, acronym. Right. So, next point. In scapula, there is present a shallow articular surface. In a scapula, there is present a shallow articular surface called glenoid cavity. In a scapula, there is present a shallow articular surface called glenoid cavity, into which the head of humerus articulate, into which the head of humerus articulate. Full stop. The pectoral girdle help our hand to articulate, Let's stop. So this was the pectoral girdle. Pectoral girdle clear?
Sir, can you please repeat the last line?
The pectoral girdle help our hand to articulate. That is the function of actually pectoral girdle. Now the next is bone of arms. Now we are going to study the bone of arms. Now it's easy. Total there are 30 bones in our arms and 30 bones are in our leg, and almost they are synonymous to each other. So I think it's so fifth bone is look, these are the bones of our arms. Now try to understand. Clavicle we have studied, scapula we have studied, right? We know what is the clavicle, what is the scapula. And look, this is the upper part of the bone. This is called humerus. So there are total one humerus here, and the lower part of hand is made up of two bones, radius and ulna, one radius and one ulna, right? So lower part. Then this is the carpal. Carpal is actually made up of this makes our wrist part. So our wrist part is made up of total 8 bones, right? Out of these 8 bones, these are small spherical ball-like structure, and these ball slip over each other. 1, 2, 3, 4. So these articulate, they help in rotation. There are 8 in number. There are 4 and 4 and 4 of row. Then there are metacarpals. So look, these metacarpals, they make they are the 5 in number. Actually, there are 5 metacarpals. So these metacarpal 1, 2, 3, 4, 5. They make actually our palm part. This palm part is made up of metacarpal. Right below the So whenever this palm part get finished, that metacarpal get finished, this upper part, these are the fingers, and fingers are basically called phalanges. So phalanges, they are total 14 in number actually, 14 number. What is, sometimes they ask you phalangeal formula. Actually, 2 bones they make the thumbs, then 3 bones this finger, 3 bones, 3 bones, and 3 bones. So rest of the 4 finger are made up of 3 bones. So phalangeal formula is actually 2 is to 3 is to 3 is to 3 is to 3. That is the phalangeal formula, and this is the formula of our finger, right? So please start coding now. Each arm is consist of, so clavicle and scapula are not part of our hand. Please try to understand that our hand starts from the humerus only. Each arm is consist of 30 bones. Each arm is consist of 30 bone. One humerus, comma, one radius, one ulna, one humerus, one radius, one ulna, comma, 8 carpels, 5 metacarpals, and 5 digits, 5 metacarpals, 5 digits, which are made up of 14 phalanges. 5 digits, which are made up of 14 phalanges. Let's stop. The phalangeal formula is 2 is to 3 is to 3 is to 3 is to 3. The phalangeal formula is 2 is to 3 is to 3 is to 3 is to 3. Next point. The head of humerus articulate in glenoid cavity. The head of humerus articulate in glenoid cavity. Next. Ulna is longer than radius. Ulna is longer than radius. Full stop. Each wrist is, next point, each wrist is composed of 8 carpels. Each wrist is composed of 8 carpels arranged in 2 rows. Full stop. Is it clear to all of you?
Yes.
Bones of arms. Okay. Next is pelvic girdle. Like pectoral girdle is shoulder, and pelvic girdle is that pelvic part. Like that, it means these are the hip part. So next is pelvic girdle. So 6 is pelvic girdle. Oh, pelvic. Yes. Pelvic. look, this part is called actually pelvic girdle. So what are the bones which make the pelvic girdle? Look, ilium, ischium, and pubis. We have already discussed that ilium, ischium, pubis. There are three bones. Basically, they fuse into one bone and they make the pelvic girdle. So, this part. So first bone is this is ilium, right? And second bone is ischium, and third bone is that is the pubic. So ilium, ischium, and pubic. These three bones fuse and they form the this one. They form the our pelvic girdle, right? And this is the base of sacrum. Here the sacrum get fits, and this part is called actually pubic symphysis. It's called pubic symphysis, right? So, and this is called actually hip joint, right? So please start noting down. Look, one more thing. This hip bone is also known as innominate bone. Hip bone. So hip bones, they are also called innominate bone. Innominate bones, right? So there are two innominate bones, mean two hip bones, right? Please note it down. The pelvic girdle is formed by two innominate bones. The pelvic girdle is formed by two innominate bone or hip bone. Two innominate bone or hip bone. Full stop. The sacrum and coccyx, the sacrum and coccyx are also the sacrum and coccyx are also the sacrum and coccyx also takes part in formation of pelvis. Sacrum and coccyx also takes part in formation of pelvis. Full stop. Each innominate bone consists of three separate bones. Each innominate bone consists of three separate bones. Ilium, ischium, and pubis. Ilium, ischium, and pubis. Full stop. On the outer surface, it have a depression. On the outer surface, it have a depression called acetabulum. To which head of femur articulate. Full stop. It forms
So through which
head of femur articulate. Which form hip joint. Like glenoid cavity was present in our shoulder, the same way acetabulum is present in our hip, where our leg rotate, right? That is a cavity like depression, that is called acetabulum. It is also known as hip joint. Next, acetabulum is formed by acetabulum is formed by all three bones. Acetabulum is formed by all three bones: ilium, ischium, and pubis. Acetabulum is formed by all three bones: ilium, ischium, and pubis. Look again. Ilium have a large depression. Ilium have the large depression called greater ceotic notch, called greater ceotic notch, ceotic notch, called greater ceotic notch, to which a sciatic nerve, to which a sciatic nerve passes, to which sciatic nerve passes. That is the sciatic nerve passes. That is the longest nerve of body. That is the longest nerve of body. Full stop. The function of pelvic girdle is to support posterior region of trunk. The function of pelvic girdle is to support posterior region of trunk. Full stop.
Posterior region of
Trunk. Full stop. It helps in articulation of leg. It helps in articulation of leg and provide surface for attachment of muscles. Right? So this was the pelvic girdle.
so I have to provide surface for
Attachment of muscles. Now the next one is bones of leg. The next one is bones of leg. 7. This is actually human leg. Look. Again, we know that the ilium, ischium, and pubis, they are the actually part of our pelvic girdle. They are not the part of our leg part. So they make pelvic. They make pelvic girdle. Now the leg makes from femur. So this is the femur. Again, the like the hand, the leg is also made up of 30 bones. So here, this is the femur. So one, it will be femur, and there is a kneecap-like structure which is not found in our hand. This is called patella. This have been asked in medical exams. Patella. This is called kneecap, right? Then there are two bones in the lower part of the leg, that is tibia and fibula. Out of them, tibia is the longer one, No, sorry, fibula is the longer one. And again, there are some like the wrist-like structure that have carpal. So in our ankle have some bones. They are called tarsals. But tarsals are not 8 in number. So carpals that the wrist bones, they are 8 in number. But here the tarsals are 7 in number. Out of these 7, they are arranged in 2 rows. The 4 in 1 row and 3 in 1 row. So this is called tarsals. 7 tarsals. So these are the 7 bones. And then it comes to the metacarpals. So there are 5 metacarpals and phalanges. Again, the phalanges are in 14 in number and the same phalangeal formula. So that is 2 is to 3 is to 3 is to 3 is to 3. So that is the phalangeal formula, right? So please just start.
So the femur is the longest bone?
Yes, femur is the longest bone. And sciatic nerve is the longest nerve of the body. It comes out of where? From where? Ilium. Right? Okay. So please start noting down. Each leg is consist of 30 bones. Each leg is consist of 30 bones. One femur, one tibia, one fibula. One femur, one tibia, one fibula, and one patella. That is kneecap. One patella. That is kneecap. Full stop. 7 tarsal. In hand it is carpal. They are 8 in number. And tarsal are 7 in number. 7 tarsals, comma, 5 metatarsal, 5 metatarsals, and 5 digits. 5 digits, which are made up of 5 digits, which are made up of 14 phalanges, which are made up of 14 phalanges, where phalangeal formula is, where phalangeal formula is 2 is to 3 is to 3 is to 3 is to 3, where phalangeal formula is 2 is to 3 is to 3 is to 3 is to 3. Next, femur is the longest. Femur is the longest and strongest bone of our body. Femur is the longest and strongest bones of our body. First off, the head of femur articulate into the head of femur articulate into acetabulum. The head of femur articulate into acetabulum of pelvic girdle. The head of femur articulate into acetabulum of pelvic girdle. Full stop. Patella is flat. Patella is flat and its kneecap. Patella is flat and its kneecap. Full stop. Tibia is longer and thicker. Tibia is longer and thicker, comma. Fibula is shorter and thinner. Fibula is shorter and thinner. Full stop. The function of leg that need not to be mentioned. So is it clear to all of you? Clear all bones?
Yes.
Yes.
now come to the joints and types of joints, right? How many type of joints are formed? So come to the joints. So next heading is joints and their type. Joints. So joints are basically, there are total three joints, three type of the joints in number. So first joints are those which are just joints, but they cannot move here and there. So first of them, they are called fibrous or immovable joint. They cannot move here and there. So first one are fibrous or immovable joint, right? They cannot move. There is no movement over there. Slight movement is possible, but there is no, almost there is a negligible movement over there, right? So the second one, joints, these joints are slightly movable joints, right? They are cartilages, they are made of cartilage. Cartilages or slightly movable joint. Slightly movable joint. Right? Cartilages or slightly movable joint. Third type of joints, they are synovial or freely movable. Synovial or freely movable joint. Or freely movable joint, right? So there are three type of the joint, right? So first, I will start from the first one, that is fibrous or immovable joint. So total three kind of joint. So first one is, that is the fibrous. So out of, let me show you the fibrous one. These are found actually in the butt, head part, right, in bone part, and they are basically almost fixed, and they are also known as the shutters, right? So look, fibrous. This is the diagram. It belongs to the fibrous joint. Look, uh, this is the fibrous joint. So, like we few minutes before, like we were studying the bones of our skull. So these bones of our skull, they are jointed like this, right? And these are called shutter, right? SUTUR. So these are called actually shutters. So these shutters are made up of, these are like stitched with the help of a fiber like structure, and those fiber like structures are get jointed, and there is no movement, and these are called shutters. SUTURE, shutters, right? And again, there is no movement between the teeth and our jaw, so they are fixed joint. They are also made up of fibrous joint. So these fiber like structure, they fix them, and even there is a between tibia and fibula, these both are stuck with each other, they are attached with each other, and then there is slightly, there is no, almost there is no movement. So these are called fibrous joint, right? So please start noting them. There is no movement between the bones. There is no movement between the bones in this type of joint. There is no movement between the bones in this type of joint. Full stop. As the name suggests, as the name suggests, there is white fibrous tissues. As the name suggests, there is white fibrous tissues between the end of bones. Full stop. Example, the joints between bones of skull. Example, the joint between bones of skull called suture. Called suture. Joint between the bones of skull called suture, and the joint between teeth and maxilla. The joint between teeth and maxilla. So these are called immovable joint, right? Next. So next category is that is the slightly movable joint. So when we comes over here, second one is slightly movable joint. So slightly movable joint, they are connected with some cartilaginous structure. So cushion-like structure are found between the two bones, which allow a slight or a little bit movement between them. So these are called cartilaginous joints or slightly movable joints. Look, so these are the slightly movable joints. In these slightly movable joint, now you can understand. Look, there is this. So suppose that this is the vertebra. This is one vertebra. This is another vertebra. Between two vertebra, there is a fibrocartilaginous band, and which is filled with the gelatinous structure. So it works like cushion. So there is a very slight movement between between two bones due to the compression of. So due to the compression of this structure, which is cartilaginous structure. So these are called slightly movement. Even there is the symphysis of pubic symphysis. There is also a cartilaginous structure. There is a very slight movement over there, right? So these are called cartilaginous joint, right? Please note it down. In this type of joint, there is a pad of white. In this type of joint, there is a pad of. In this type of joint, there is a pad of white fibrocartilage. There is a pad of white fibrocartilage between the end of bones taking part. Between the end of bones taking parts. Between the end of bone taking part in the joint, which allow very slight movement. Full stop. The movement only possible because of compression of cartilage. The movement only possible because of compression of cartilage. Example, pubic symphysis, and the joint between vertebrae. and the joint between vertebrae, right? So these are the slightly movable joint. Now come to the next. So next part is that is the freely movable joint.
So what's the other example?
Pubic symphysis and the joint between the vertebrae. Pubic symphysis and the joint between the vertebrae. So next one are synovial or freely movable joint, right? So synovial joint are known because they are there is a synovial membrane which secrete the synovial fluid, and they are freely movable joint. So let me explain you the synovial joint. Look, this is the structure of a synovial joint. So this upper part is made up of, this is basically the bone of our leg, right? So the upper part, it is made up of the bone, lower part is made up of bone, and at the head of these bones, they are made up of articular cartilage. So they are made up of a type of cartilage, so that the friction between the two bone or collision between the two bones do not take place. So these are the cartilage structure. And there is a membrane which surround it, that is called synovial membrane. Synovial membrane secrete a special kind of the fluid that is called synovial fluid. Synovial fluid have density or viscosity. It is sticky like the egg white, like the egg white, right? It work like a grease, reduce the friction, and these kind of the joints are called synovial joints. Clear?
Yes, sir.
So start noting now. There is present a membrane called synovial membrane. There is present a membrane called synovial membrane. Full stop. This membrane is composed of secretory. This membrane is composed of secretory epithelial cell. Secretly epithelial cell. This membrane is composed of secretory epithelial cells, which secrete a thick sticky fluid. Which secrete a thick sticky fluid. Full stop. The consistency of fluid is like egg white. The consistency of fluid is like egg white, and it is known as synovial fluid, and it is known as synovial fluid. Full stop. It acts as a lubricant to joint. It acts as lubricant to joint, provide nutrient material. It acts as lubricant to joint and provide nutrient material for structure. Full stop. Bones are covered with articular cartilage. Bones are covered with articular cartilage, which is a type of hyaline cartilage, which is a type of hyaline cartilage, which is a type of hyaline cartilage. Full stop. Ligament join the bones and tendon. Ligament join the bones and tendon connect a bone with muscle. Ligament join the bones and tendon connect the bone with muscle. Full stop. Now the next which we will study, that is the type of synovial joint, right? So you can note it down. Type of synovial joint. So next heading is types of synovial. Right. So how many types of the synovial joints are found? Synovial joints are, they are the freely movable joint. They are of many types. Basically, they are of 6 types. Look, these are synovial joints. Right? These are type of synovial. So in today's class, I'll explain these kind of joints, synovial joints. In next class, we'll study in detail types of synovial joint, then sliding filament. So look, there are pivot joint. The pivot joint is found in our neck region, right? So out of them, the first kind of joint that is called pivot joint, first kind, right? So it allows movement in 2 planes, 1 and 2, right? These in 2 planes, right? And then there are cartilaginous joints, and then the second one, saddle joint. Saddle joint is found in our palm part, right? Saddle joint. First is pivot, second is saddle joint, and then you can see this is the hinge joint. Hinge joint opening only in one direction, so this is the hinge joint, and this is the plane joint. So plane joint is between the 2 bones when they are put, and they can move just like this way, right? So this is called plane joint, and the both of the bones must have the flat surface. The adjoining surface, this must be flat, right? And then this is the ball socket joint. This is the most freely movable joint, like it can move in any direction. So the plane joint is like 4th, and the 5th one is ball socket joint, and this is the ball socket joint. And last but not the least, there is a one more joint that is called ellipsoidal joint. Ellipsoidal joint, right? So that is the 6th one. So there are these 6 kind of the joints. Please note it down the type of joint, right?
So
And yes, please.
what causes joint pain? Like in elderly people, they often get joint pain.
Joint pain, actually, there are certain disease. Uh, in general, what happens between the joints, the formation of uric acid takes place. As we have studied excretory system, urea formation takes in our body, uric acid formation do not takes in body. So due to some defect, due to some deficiency, due to some disease, formation of a small crystal of, and we know that this is the crystal. So formation of the crystal of uric acid takes place between these joints, right? And it deposit between the joints. Whenever a person try to move or the joint rotate, so what happened? These crystal, they give the scratch to the bones or cartilages part, and that's how they feel the pain. The person feel pain, right? So this is the reason. This is also called the what to get gout. This is also called gout, right? So you this basically takes place due to uric acid formation. The second thing, synovial fluid get what what to say synovial fluid gets stuck, and synovial fluid uh, becomes dry. That is also a part, and bones start rubbing with each other. That is also a part of the joint pain. So these are the 2 main reasons, right?
So some people say that due to the lack of this fluid between the joints also causes pain.
Right. That's what I said. First, formation of uric acid. Second, this fluid get dry. So when the fluid get dry, then the bone starting the friction with each other. So due to the friction, the pain will start. But the first one is the most prominent reason. The second one is the less prominent reason. Because the second one can be maintained with the help of medicine, with the help of some external oils and all that, right?
Okay, sir.
So these are the type of joint. In next class, we'll study in detail all these types of joint, types of synovial joint. Clear? So if you have any doubt, please ask me in today's session. In next class, we'll finish and move in next chapter.
I have a question. It's out of topic. Can I ask?
Sure.
There is a child born in our family recently. She is around 1 month old. She is going through hypocalcemia.
Hypocalcemia. Right.
That's lack of calcium, I guess.
Right.
So, and she is also suffering from fits.
Okay.
So, sir, does fits like is it a cause of hypocalcemia only, or it's something else?
As per my concern, this is the cause of hypocalcemia, and hypocalcemia takes place due to the this secretion, parathyroid secretion. So what parathyroid do? Parathyroid reduces the amount of calcium in our blood. So when the more secretion or means hyper secretion of parathyroid hormone takes place, it reduces the amount of the calcium in blood, right? So when the amount of calcium in blood takes place, so what happens? First, the growth reduces. And the second important thing, calcium is also responsible for the contraction and relaxation of the muscle. We will study in this chapter only, next class, sliding filament theory, right? So because the calcium, the amount of the calcium reduces, then the jerk takes place in the bones, muscles. So that also causes fits. So this is all due to the calcium only.
Okay, sir.
Because the fits are, there are two kind of the fits. First, because of these calcium and all that deficiency. Second, that is due to the neural system. So this is the because of the calcium mainly 99% this is due to the calcium deficiency, right?
Okay, sir. Thank you, sir.
Welcome. Fine. So see you in next class, right? And we'll continue with this, right?
Thanks, sir.
Okay.
Thank you, sir. Thank you, sir.
Okay. Welcome. Bye. Bye, all of you. Good night. Take care.
Thank you, sir.
Welcome, beta.